The glenohumeral joint contains the head of the humerus and the glenoid cavity of the scapula. It is the most freely movable joint in the body, but this means its stability is sacrificed. Its movements include flexion, extension, abduction and adduction, rotation both medially and laterally, and circumduction. Joint support of the glenohumeral joint includes the glenoid labrum, and that is a fibrocartilage rim that expands the depth of the glenoid fossa and allows for increased motion. We also have a fibrous joint capsule, and that encloses the joint structures, and the synovial membrane lines the inner surface of the joint capsule. I also want to point out that the articulating surfaces of the humerus and the glenoid cavity are covered with hyaline cartilage. There are several ligaments that support the glenohumeral joint, and they include the glenohumeral ligaments, the superior, middle, and the inferior, the coracohumeral ligament, the transverse humeral ligament, and the coracoacromial ligament. Lastly, I want to discuss the bursa, and bursa reduce friction and help facilitate movement. So around the glenohumeral joint, we have the subacromial and the subdeltoid, which sometimes are continuous, the subcoracoid bursa, and the subscapular bursa. The acromioclavicular joint consists of the acromial end of the clavicle and the acromion of the scapula. The main movements that we have of this joint is when the acromion of the scapula rotates on the end of the clavicle. The AC joint is enclosed by a sleeve-like capsule, and we call that the acromioclavicular ligament, and it maintains most of its strength from the coracoclavicular ligament, which is subdivided into the trapezoid and the conoid ligaments. Lastly, the sternoclavicular joint runs between the sternal end of the clavicle and the manubrium of the sternum. It is divided into two parts by the articular disc. A joint capsule surrounds the joint, and the anterior and posterior SC ligaments reinforce the capsule. There is also the costoclavicular ligament, which strengthens the joint superiorly, and the interclavicular ligament, which anchors the inferior surface of the sternal end of the clavicle to the first rib and the costal cartilage. The joint is very mobile for upper limb movement, and the clavicle can move up to 60 degrees for elevation of the upper limb.